Hi, welcome back. In this mini lecture, we're going to talk about insight therapies. Before we talk about what insight therapies are, just a brief introduction about psychotherapy. So psychotherapy is when a couple or a group or an individual person works with a therapist to discuss their concerns and their problems. And about 20% of Americans are in therapy at least once during their lifetime. And at any given time, we have about 4% of the American population in therapy. Now, keep in mind that a lot of people believe that therapy is only for individuals who suffer from psychopathology, but that's actually not the case. Everyone can benefit from psychotherapy. So even individuals who are not suffering from some sort of mental illness can still benefit from psychotherapy. Now, of course, there are differences in who seeks out psychotherapy. So, for example, women are more likely than men to seek out psychotherapy, and Caucasian individuals are more likely than other ethnic groups to seek out psychotherapy. And these differences in gender and ethnicity are true, even though research has found that psychotherapy benefits all people, regardless of gender and ethnicity and whatever other group you may belong to. And the effectiveness of psychotherapy depends on the type of problem that the person is experiencing. So more minor problems are easier to solve via psychotherapy. But if a person, for example, is very severely psychotic, then it might be a little more difficult to help a person via psychotherapy alone. All right, so insight therapies. Insight therapies aim at helping a person understand their motives and their actions. Basically, we're trying to gain insight about ourselves with insight therapies. And the psychoanalytic and humanistic approaches are examples of insight therapies. So psychoanalysis, hopefully the first person you think about when you see the word psychoanalysis is Freud. Because Freud and those influenced by Freud are the ones who practice psychoanalysis. People who practice psychoanalysis are in agreement about three things. First is that we have to look at our traumatic childhood experiences. Second, psychoanalysts tend to analyze. So they want to analyze, for example, your wishes or your avoided thoughts. And the belief with psychoanalysis is that we have to gain insight into our unconscious. And once we gain insight into our unconscious to understand why a person is experiencing the symptoms that they have, the symptoms will then disappear. So SX on the slide is symptoms. So remember, psychoanalysts individuals believe that the reason why people suffer from psychopathology is because of unconscious issues that tend to come from traumatic childhood experiences. So all we have to do is talk about those traumatic childhood experiences and gain insight into the unconscious in order for the psychopathology symptoms to disappear. The goals of psychoanalysis are to decrease guilt and frustration that stem from the unconscious or unconscious conflicts, for example. And like I already mentioned, to make the unconscious conscious. So psychoanalysts use two techniques. Well, they use more than two techniques, but two of the techniques that they use would be free association and dream analysis. And with free association, the client is allowed to freely speak about whatever it is that they want to talk about without any censorship. So the client just sits down in the room with the psychoanalyst, and the psychoanalyst will allow that person to freely speak without any censorship. Dream analysis is what it sounds like. It's when we're dreaming, we're analyzing our dreams. And you might remember that Freud and psychoanalysts in general, when they analyze dreams, they're looking for the manifest content, which is the details of the dream, but the latent content is the important part. The latent content would be the hidden meaning of the dream. So we're going to analyze dreams in order to find out the hidden meaning of those dreams. In psychoanalysts, the therapists are also going to point out when the client is experiencing resistance. So think about resistance like you're resisting treatment. An example of resistance would be when a client shows up to therapy late, or when a client changes the topic when something comes up. They're resisting treatment in some sort of way. And psychoanalysts believe that in order to reduce resistance, the psychoanalyst needs to tell the client, hey, by the way, you are showing me some resistance. You are coming to your meetings late, or you're changing the topic. And just by telling the client that they are resisting will then reduce the resistance. The idea of transference, think about it like you're transferring your feelings or your thoughts or your behaviors from one person onto another. So for example, you might treat your therapist differently because your therapist might unconsciously remind you of your father or your sister or someone. You might treat your friends differently because unconsciously they remind you of, I don't know, your brother or your teacher. And you might be surprised to know that there's actually a lot of, well, there's sufficient evidence to suggest that transference actually is a thing, that we do in fact treat people differently based on who they might remind us of. There's a neo-Freudian tradition, which is basically not traditional psychoanalysis, but new psychoanalysis. And they still focus on the unconscious, but they also focus on the conscious. And in contrast to traditional psychoanalysts, neo-Freudian psychoanalysts are more comfortable with, or they more often ask questions during sessions, or they make suggestions to their clients. They offer their interpretations and they give their opinions. Keep in mind that psychoanalysis benefits individuals who are not experiencing psychotic symptoms. So if a person, for example, is experiencing severe schizophrenia, they won't be able to benefit from psychoanalysis as much as a person who, for example, might be experiencing generalized anxiety disorder. The reason for this is because you need to be in touch with reality and to be able to express yourself in an intellectual and clear manner in order for psychoanalysis to work. All right, next we have humanistic psychotherapy. And humanists believe that human nature is positive, meaning we are all good people at the core. And humanists believe that we have a sense of alienation. And kind of think about it. You might feel alienated or isolated from other individuals. People tend to feel like they're the only ones who are experiencing whatever it is that they're experiencing. And with humanistic psychotherapy, one of the goals is to help people overcome the sense of alienation that's very prevalent in our society. They also aim to help people develop insight. Remember, it's an insight therapy. They want to help them express their creativity and become their authentic selves. Now, unlike the psychoanalytic approach, humanistic psychotherapy wants their clients to assume responsibility for their decisions and to live in the present. Forget about the past, we have to focus on the present. Two common humanistic psychotherapies would be person-centered therapy and Gestalt therapy, which we'll review next. All right, so with person-centered therapy, the therapist is going to focus on the client's goal. So the therapy is centering on the client's goal. The therapist is also going to provide the client what's known as unconditional positive regard, meaning the therapist is going to provide the client with positive, loving feelings like affection, regardless of what the client says and does. So unconditional positive regard, another way to think about that would be unconditional love. Also in person-centered therapy, the therapist does not tell the client how to solve their problems, and the client is able to use the therapy session in any way they wish. So if the client wants to just sit there and talk all session, they can do that. If they want to stay silent all session, they can do that. And the person-centered therapist wants to help the client gain awareness and self-acceptance. It's called person-centered therapy because the person really is at the center. Gestalt therapy is another type of humanistic psychotherapy. And with Gestalt therapy, the aim is to help people integrate divergent parts of themselves into a unified self. So think about ways that you might act differently around certain people. So the idea here is that you have your true self, But then you also have a self that you show other people. So kind of like you're putting a false mask on your face when you're around other people. And so what we want to do with Gestalt therapy is to remove this false mask so that the person is able to show who they really are. And that's going to be unified with the person that they've been showing other individuals. So we're taking off the false mask, because when we have a false mask, this gives unhappiness. So by taking off the false mask, you'll help the person feel happier, and this will help them overcome certain types of psychotherapy, or sorry, psychopathology. Also, Gestalt therapy aims at helping people gain self-awareness, also self-acceptance, as well as free expression of their feelings. Now, Gestalt therapy is different than person-centered therapy in that Gestalt therapy is more directive. So the therapist who performs Gestalt therapy is going to have planned experiences for their clients. So, for example, the two-chair technique is a common planned experience. You could see it here in the picture. You have the client sitting in one chair, and then the other chair is empty. And the client talks to this empty chair. This empty chair could signify the part of yourself that's wearing the mask or that's not wearing the mask. It can signify some other person in your life. Whatever it may be, you're talking to this other aspect of yourself or this other person in the two-chair technique. All right, so that's it for Insight Therapies. If you have any questions, don't hesitate to ask.